Next, we have the psoas major muscle. The psoas major, as I mentioned earlier, is located much nearer to the midline as compared to quadratus lumborum, immediately lateral to lumbar vertebrae. It arises from the transverse processes and vertebral bodies of the 12th thoracic vertebra up till the 5th lumbar vertebra. It then moves inferiorly and laterally, running deep to the inguinal ligament and attaches to the lesser trochanter of the femur along with iliacus muscle. It receives its innervation from the anterior rami of first, second, and third lumbar spinal nerves. This muscle is particularly important for flexion of the thigh at hip joint and lateral flexion of the vertebral column. Next, we have psoas minor. The psoas minor is a variable muscle. It may be present in up to 60% of the population, and in rest of the people, it may entirely be absent. So it is subjected, its presence is subjected to variation. Attachments क्या है psoas minor की? Psoas minor arises from the vertebral bodies of the 12th thoracic vertebra and first lumbar vertebra, and attaches up till the superior ramus of the pubic bone. This, you remember, is the pubic part of the hip bone, comprising of body, a superior ramus and inferior ramus. And psoas minor attaches over the superior ramus of the pubic bone. It receives its nerve supply from the anterior rami of the first lumbar spinal nerve. And the action is that it is responsible for the flexion. I hope you know the flexion of the vertebral column. It is the forward bending, right? Forward bending of the vertebral column. So it is responsible for the flexion of the vertebral column. Next, we have iliacus muscle, which is a fan-shaped muscle that is situated inferiorly on the posterior abdominal wall. It combines with the psoas major to form what? Iliopsoas muscle. You remember it, you both MBBS and DPT remember this muscle and its attachment from your knowledge of lower limb gross anatomy. And together with the psoas major muscle, it gets inserted just like psoas major over the lesser trochanter of the femur. It receives its nerve supply from the femoral nerve, root value L2, L3, and L4. And its actions include flexion and lateral rotation of the thigh at which joint? Hip joint. And the last muscle in the posterior abdominal wall is the diaphragm, which I have covered in detail with the thorax. Suprarenal glands. These are two in number, right and left, located over the upper poles of the both kidneys. These glands are yellowish in color and they are located retroperitoneally over the upper poles of both kidneys. They are surrounded by the renal fascia, but they are separated from the kidneys with the help of perirenal fat. So the suprarenal glands along with the kidney are enclosed by the renal fascia, but still the two structures are separated from each other with the help of perirenal fat. Each gland has a yellowish colored cortex, outer cortex, and a dark brown colored medulla. So the center of the gland is called medulla and the outer part of the gland is called cortex. The cortex of the suprarenal glands, it is responsible for the secretion of the hormones, which include the mineral corticoids, glucocorticoids, and the androgens hormones. Medulla of the suprarenal gland is responsible for the secretion of the catecholamines, which include the epinephrine and norepinephrine. There are some gross anatomical differences between the two suprarenal glands, right and left. The right suprarenal gland is pyramidal in shape, whereas the left suprarenal gland is crescentic in shape. The right suprarenal gland, it covers the upper pole of the right kidney, whereas the left suprarenal gland extends along the medial border of the left kidney from the upper pole so that it almost reaches the hilum of the kidney. The right suprarenal gland lies behind the right lobe of the liver and extends medially behind the inferior vena cava. The left suprarenal gland lies behind the pancreas, the lesser sac, and the stomach, and posteriorly it rests over the diaphragm. Blood supply of the suprarenal glands, as you know, blood supply includes arterial supply and venous drainage. So the blood supply of the this arterial supply of the adrenal glands is very important. It is about 60 to 70% question that is asked in the MCQs of the university examination in the prof. So there are at least 3 arteries that supply each suprarenal gland. The 3 arteries, they are named as 3 suprarenal arteries that arise from, number 1, inferior phrenic artery, number 2, abdominal aorta directly, and number 3, renal artery. So 3 suprarenal arteries, they supply each suprarenal gland, and they are the branches from upward to downward. These are the branches from inferior phrenic artery, abdominal aorta, and renal artery. What about venous drainage? In each suprarenal gland, there is single vein. So we have 1 vein and 3 arteries for each suprarenal gland. The right suprarenal vein is short because it lies closer to inferior vena cava, into which it also drains. The left suprarenal vein is longer because it has to take a long course in order to reach the final destination via left renal vein. So at first, it is joined by the inferior phrenic vein, and both of these veins enter the left renal vein, which finally takes the blood to the inferior vena cava. Again, the differences between these 2 suprarenal veins is asked very oftenly, if not commonly, in the MCQs by the University of Health Sciences in professional examination. The lymphatic drainage from the suprarenal gland passes to the lateral aortic lymph nodes, and the suprarenal gland receives their nerve supply from preganglionic sympathetic fibers that are derived from the splanchnic nerves. And majority of these nerves, they end in the medulla of the gland.